Hello everyone, welcome back to channel GDC English. Here we have the TS PGECET question paper 2018, and let's start with the pharmacology we do have over here. Some questions we'll be discussing about the pharmacology with the detailed explanation over here. So let's get started with the first question over here. Yeah. So that's the first question says that upper limit of dose response curve indicates what? It's your therapeutic index, drug potency, drug efficacy, or change in response per unit. Right. So dose response curve. What is dose response curve? Let's understand that one. Now, so what is have that? This is your x and y axis, right? Onto the x axis we have dose, right? We have dose, and here we have the response. So at a particular dose, for example, the paracetamol. For example, paracetamol showing the therapeutic efficacy onto the 100 mg of dose, right? So for example, this is your 100 mg, and it is showing this kind of response, right? So this is your peak. You can say peak response will be finding over here, right? So this you can say like this is the response period, right? So what is the upper limit? So for example, this is a dose and this is a response over here. And after some time, this response going to be decreased down with the time, right? So what is this peak known to be as? So this is obviously going to be a response, and in response, what thing will be efficacious? That's your drug efficacy only, right? So drug efficacy is going to be your correct answer, right? So let's go ahead now. So here we have next question: absorption of lipids. That's your fats, Anna. So in the small intestine is facilitated by. So you know that lots of fats and your essential nutrients gets absorbed through the small intestine because the small intestine have the large surface area, and that is responsible for the increased absorption of those nutrients, right? So what kind of transport mechanism is involved in that kind of transportation? Is it your passive diffusion, active transport, carrier mediated transport, or facilitated diffusion? So just there is very much simple kind of a concept, whether it is lipids, whether it is essential nutrients, or whatever it is. If it is going to be absorbed from the small intestine, then passive diffusion is going to be takes place. And what is passive diffusion? The transport of the drug molecules from the higher concentration to lower concentration. That is what passive diffusion. And it follows which reaction? That's your Fick's first law, right? Fick's first law. It's going to be follow. And what's that? What's that equation if I talk about? So that's your dq by dt is equals to dak O by W, that is nothing but your partition coefficient, and then concentration gradient, CGIT minus C upon H, right? So this is your Fick's first law, which will be followed by the passive diffusion. If I talk about active transport, the active transport do the thing against the concentration gradient from lower concentration to higher concentration, and that also requires a semi-permeable membrane. Okay, all right. In carrier mediated transport, we do have some carriers, right? Which are your endogenous carrier. And that is why, just because those carriers are very much limited in amount, so that's why we can say like this carrier mediated transport have the mixed order kinetics. First of all, it will be showing some first order kinetics, and then afterward it will be showing, for example, this is up to first order kinetics, and this is going to be your zero order kinetic, and that's why we called as that carrier mediated transport follows the mixed order kinetics. That's your Michaelis-Menten kinetics. All right. So let's go ahead. Here, this one. Ingestion of tyramine-rich fruits should be avoided with which of the following drug? Is it your tetracycline, monoamine oxidase inhibitor, anticoagulants, or beta blockers? So what is tyramine? Tyramine means cheese. Cheese. The cheese present in your, you can say like dietary foods to be precise. For example, your paneer, your dairy products, cheese, right? So these are having tyramine-rich products, and that should be avoided with monoamine oxidase inhibitors. What's that? MAO inhibitors, right? MAO inhibitors are your salicylic, resagiline, moclobamide, chlorgyline, right? Tranylcypromine, isocarboxazide, and P for phenylzine. All right. So we do have different kinds of the monoamine oxidase inhibitor, which are going to inhibit the MAO enzyme. And why there is a need to inhibit MAO enzyme? Because. See, what's the chronology over here? What's the chronology over here? For example, you have taken tyramine rich food. For example, paneer you have taken, right? Paneer you have taken, or you can say like cheese you have taken, right? Cheese you have taken, right? This product have the tyramine. This product have tyramine, and tyramine is responsible to increase the adrenaline, right? To increase the adrenaline. Why? Because it do have some catecholamines as well. Catecholamines. means as well, and that's why it is going to increase the adrenaline synthesis, right? Adrenaline synthesis. And you know that there is an enzyme, that's your MAO enzyme, monoamine oxidase. It's an enzyme which is going to inhibit this adrenaline, right? But if you inhibit this MAO enzyme only through MAO inhibitors, then what's going to happen? Then what's going to be happen? This MAO enzyme going to be inhibited. Now adrenaline release will be more. Now, if adrenaline release will be more, what will happen? Your hypertension can be takes place, right? BP will be increased, right? Your force of contraction of the heart can be increased. Your cardiac output is going to be increased, right? So that will leads to what? Hypertension. And that's why it is known to be as you shouldn't take those cheese containing product or tyramine containing product with the MAO inhibitor. Otherwise, what's going to be happen? Hypertension crisis. What's that? Hypertension crisis is going to be takes place, and that is also known to be as your cheese reaction. What is that? It is also known to be as your cheese reaction. By the way, if this happened, right? But which drug can be take out? Which drug can be used in these kinds of condition? That is nothing but your pentolamine. Okay, pentolamine and tolazolene. Pentolamine as well as tolazolene can be taken into the this condition. All right, so let's go ahead. Okay, so which of the following is an example of type B adverse drug reaction? Okay, type B adverse drug reaction. The type B considered to be B stands for bizarre, right? B stands for bizarre condition. A for augmented, B for bizarre, C for chronic, and D for delay, right? So which of the following is an example of type B adverse reaction? Is it your bleeding from warfarin, nausea from digoxin, breast necrosis from warfarin, or ataxia from phenytoin? What's that? This is your breast necrosis from warfarin because this is very much bizarre, right? Dangerous and unpredictable, right? We can't predict that one as dose independent as well. So that's why breast necrosis from warfarin. Okay, now this one. Therapeutic drug monitoring is not required for lithium, theophylline, gentamicin, or omeprazole. What's that? Therapeutic drug monitoring. Therapeutic drug monitoring is the, you can say like, uh, checking of those plasma concentration of the drug, right? Into the plasma, obviously. So it is not required to be done out of which of the following drugs? Is that your lithium, theophylline, gentamicin, or omeprazole? That's it going to be your omeprazole, guys. If you remember, there is a trick to remember. A drug possessing very low therapeutic index. Okay, if any drug having very low therapeutic index, that only drug is just considered to be come along into the therapeutic drug monitoring, right? TDM, जिसको कहते हैं, right? So obviously this omeprazole doesn't have any kind of the low therapeutic index. That's why therapeutic drug monitoring is not being required for that. Whereas if I talk about, there are some more keywords which is associated with omeprazole, that is your enzyme inhibitor, guys. Enzyme inhibitor, right? Inhibitor. So if it is considered to be as enzyme inhibitor, so they can also ask you a question like this: which of the following PPIs, for example, omeprazole, pantoprazole, lansoprazole, esomeprazole, right, rabeprazole, what of the following do have that enzyme inhibitory action, and that usually came in NIPER 2020-23 examination. Okay, so remember this one, the omeprazole is going to be your correct answer. Fine, so the combination of ACE inhibitor and spironolactone can increase the risk of what? Hyperkalemia, tachycardia, bradycardia, or orthostatic hypotension. Yeah. See, ACE inhibitor also considered to be causing hyperkalemia, and spironolactone also considered to be as hyperkalemia. Why? Because spironolactone is also obviously known to be as a potassium sparing diuretics. Potassium sparing means you spare the potassium. So that's why hyperkalemia is going to be takes place. ACE inhibitor as well as spironolactone can cause hyperkalemia. Okay, now this one. Which of the following is the drug of choice in the treatment of status epilepticus? Okay, so this question is found to be thoda sa controversial, right? So is it your lorazepam, carbamazepine, clonazepam, or topiramate? Yeah, some of the options do usually go towards the diazepam as well, diazepam as well. Lorazepam is being given through IV, whereas diazepam is also being used in your status epilepticus. Okay, that's your seizures. Okay, chalo. Now, which of the following is not an ocular hypotensive drug? Ocular hypotensive drug. Hypotensive means decreasing down the intraocular pressure, right? Decreasing down the intraocular pressure. And what amount of intraocular pressure is required to be considered to be as a glaucomic condition, that is nothing but your 21 mm Hg. So whenever you go onto the eye clinic, eye checkup, right? They usually check your eye pressure in both of these eye. So if that pressure in your eyes exceeds towards 21 mm Hg, then that condition is known to be as a glaucoma condition. All right. So that's what they have asked over here. Which of the following drug it doesn't have any hypotensive drug ability, right? So is it your acetazolamide, tremolol, bremonidine, or ephedrine? Simple. If you go towards the classification of anti-glaucomic drug, what's going to be happening? I told you that's your ABC. ABC are very much important to decreasing down the aqueous humor secretion. Aqueous humor secretion. Right? So this is going to be your ABC. A for alpha 2 agonist, B for beta blockers, and C for carbonic anhydrase inhibitor. C. Brimonidine is your alpha 2 agonist. Timolol is your beta blocker. Acetazolamide is your carbonic anhydrase inhibitor. What left now? Ephedrine only, right? So ephedrine doesn't have any ocular hypotensive ability. So that's why ephedrine is going to be your correct answer. Simple. Chalo, let's go ahead now. One of the following statement is incorrect about hybridoma technology. So yeah, in B Farm days also we used to have studied about this one hybridoma technology in biotechnology subject, right? So that is considered to be as to produce monoclonal antibodies, right? So which of the following statement is incorrect? They are asking. Okay, chalo. So hybridomas are found by the fusion of B cells as well as myeloma cells. Yes, obviously there is a one kind of cancer cells as well that is usually required for producing those monoclonal antibodies. Okay, hybridoma are fused with HET medium. Hybridoma produce monoclonal antibody, that's for sure. Hybridoma fusion can be mediated using polyethylene glycol. Yeah, that's for sure. But this B statement is not correct. That is not usually fused with HET medium. Okay, so this is you have to keep this thing in your mind. Okay. Now, hydralazine. Hydralazine is what? Venous dilator, arterial dilator, high ceiling diuretic, or central acting sympathetic. Simple most question you can expect from the cardiovascular drugs. What's that? Hydralazine is considered to be as your arterial dilator. And I told you one trick to remember, that's your MDH, right? MDH. What's that MDH? M for minoxidil. Minoxidil, as well as D for diazoxide, if I talk about diazoxide, and H for hydralazine. These are all the drugs which are considered to be as potassium channel opener. Okay, potassium channel opener, and they used to do what? Arterial dilation, right? And also, if they're going to dilate your arteries, then what's going to happen? After load, right? After load is also going to be decreased down, and the resistance of pumping the blood in your heart is also going to be decreased down. That's why hydralazine is considered to be as an arterial dilator. And yeah, in pregnancy, hydralazine is also be considered to be as anti-hypertensive drug in pregnancy. That's a safe drug. In pregnant women, if I talk about in the case of pregnant women, women's have very much restrictions onto the medicines. That's why only some or few medicines are approved for their different conditions. For example, if I talk about this hypertension, this hydralazine, methyl dopa, clonidine, you can say like beta blockers as well. These are very much safe for your pregnancy condition. Okay, sure. Now, mannitol acts through osmotic diuretic only when administered through orally, intravenously, intraperitoneally, or subcutaneously. So mannitol, I used to remember when one of my relative also got admitted into the hospital. This mannitol I used to give through drip. Drip. That's your intravenous condition, and that's not even a bolus. That's an infusion, right? Infusion. That means what's the difference between infusion and bolus? Bolus is that once you give that injection in a single shot, right? That is what bolus, but the patient is lying on a bed and the continuously drip is being running out of there. So this intravenously infusion is used to be given for the mannitol. Okay. So now dash is a prokinetic drug. What is the prokinetic drug? Prokinetic drug means that is going to increase the motility of your bowel, right? Prokinetic drug are your to increase the intestinal motility. Intestinal motility. Okay. This is going to be your the thing of prokinetic drug. What are those actually? And because once you have constipation, right? So once you have constipation, you want some drug which move something further which is contained in your stomach right now, right? So that's why we do have domperidone, promethazine, haloperidol, or ondansetron. Obviously, we do have domperidone. If you remember this drug, pan-DSR, है this drug is very much marketed into the market. Pantop DSR, है Pantop is pantoprazole, D is for domperidone. That is what a prokinetic drug, which is also useful to increase the intestinal motility so that your constipation kind of a thing gets relieved in yourself, right? So domperidone is going to be your correct answer, right? So now this one. One of the following is an inhaled glucocorticoid for asthma therapy. Okay, so which one is used to be given as asthma therapy is not an inhaled glucocorticoid. Okay, I missed this word. Okay, so you also be have to be remember and aware at this point whenever you read a question. Just look at those keywords: not, except, true, incorrect, right? These kinds of keywords are very much important to look out for. So this is going to be your beclomethasone, budesonide, fluticasone, or prednisolone. Obviously, it is your prednisolone, guys, which is not given through inhaled. It is be taken as through tablet only. Okay, so this is important to remember. Asthma. Okay, so now which of the following is a non-sedating antihistaminic? Okay, antihistaminic. That's your H1 antihistaminic to be precise, right? But in H1 antihistaminic, we do have two kinds of generations, right? First generation as well as first generation as well as second generation, right? First generation are considered to be as your sedative because they have anticholinergic property. They do have anticholinergic property, and that's why it is known to be as sedative in nature. But second generation doesn't have any kind of the non-sedative, doesn't have any kind of the sedating effect. So out of these four options, which one is going to be correct? Is it your fexofenadine, promethazine, chlorpheniramine, or meclizine? You would have seen that combination as well into the market. That's your, if you remember, montelukast plus fexofenadine. What's that? Montelukast plus fexofenadine. This combination is very much marketed right now for allergic condition, right? So that is why montelukast and fexofenadine is not a sedative. Whereas if I talk about this promethazine, chlorpheniramine, as well as meclizine, these are sedative in nature. Once you take these drugs, you will be feeling there is very dizziness, right? So that's why this fexofenadine is a non-sedative antihistaminic drug. Okay, chalo. Now, aspirin is strictly contraindicated in one of the following disorders: is that acute rheumatoid fever, hemophilia, post myocardial infarction, or rheumatoid arthritis. Aspirin is very much strictly contraindicated in your hemophilia, guys, because aspirin is itself having your antiplatelet effect, right? What's that? Antiplatelet effect, right? So that's why hemophilia it is not should be given because bleeding can be prolonged, right? Chalo. An example of pyrimidine antagonist. Okay, so these are all your anti-cancer drugs, है ना? Azathioprine, fludarabine, clofarabine, or citarabine. What's that? An example of pyrimidine, that's your obviously citarabine, right? Okay, gemcitabine, citarabine. These are your example of pyrimidine antagonists. Okay, so formation of covalent link between an enzyme. Formation of covalent link between an enzyme inhibitor as well as enzyme can cause what? Competitive inhibition, non-competitive inhibition, irreversible inhibition, or reversible inhibition. So if you know covalent bonding, it is just like a fevipic, irreversible. If this substrate it binds with the enzyme in a covalent linkage, then this is going to be irreversible. The substrate cannot be able to go back once after it's bind with your enzyme, right? So that's why it is going to be your irreversible inhibition. Okay, so very nice. Now, one of the following exhibits weak anabolic activity. Anabolic is your body building activity, right? It do have some testosterone, which is going to be have bodybuilding, building muscle. those hormones is very much associated for your anabolic. But here, what they have asked, it's a weak anabolic. Stanzolol, good. Danazolol, yes, that is not a strong anabolic activity. It has weak anabolic, so that's why danazol is going to be your correct answer. Okay. Now, imatinib. Imatinib is useful for chronic myeloid leukemia, chronic lymphocytic leukemia, Hodgkin lymphoma, or multiple lymphoma. So these imatinib, tilotinib, as well as N for nilotinib. Okay, these three drugs are very much useful for your chronic myeloid leukemia, and these are all your PCR, ABL, PCR, ABL, tyrosine kinase inhibitor, tyrosine kinase inhibitor. Okay, that's you have to remember. And direct questions from the targeted drugs of the anti-cancer drugs they used to ask. Okay, so this is A going to be your correct answer. Now this one. Emergency post-coital contraceptive combined pill contains what? Emergency post-coital means you have done the coitus, yeah, you have done your intercourse, and after that you want that contraceptive pill, right? So what that pill contains? Is it your only ethinyl estradiol, norethindrone levonorgestrel, levonorgestrel and ethinyl estradiol, or mifepristone, levonorgestrel? This is going to be your levonorgestrel as well as ethinyl estradiol, which contains their pill. Okay, as a contraceptive. Okay, now this one. Which of the following is not a goitrogen? Is not a goitrogen. Okay, not a goitrogen means which of the following doesn't induce decrease in the iodine levels? Decrease in the iodine levels. Thiocyanate, decrease. Carbimazole, decrease. Sodium iodide, no. Lithium, decrease. So sodium iodide is going to be a correct answer. Simple, right? Chalo. Which of the following is an intermediate acting insulin? Intermediate acting insulin. Intermediate acting insulin is your NPH insulin, guys. NPH insulin as well as your semi-lente, if I talk about. Semi-lente insulin, that is also considered to be as intermediate acting insulin. Whereas if I talk about this one, Lispro as well as glargine as well as, sorry, Lispro, glulicine as well as aspart, right? These are considered to be as a very short acting, or you can say like rapid acting, rapid acting. Glargine is considered to be as well as detemir, glargine as well as detemir insulin. This is considered to be as your long acting drug. Okay, long acting drug, insulin preparation. Okay, chalo. Now this one, menadione. Menadione is what? Menadione is your obviously congener of vitamin K. So is it your active metabolite of phytonadione, metabolic precursor of vitamin K2, and inactive metabolite to vitamin K2, or anticoagulant? That is your metabolic precursor to vitamin K2, menadione. Okay, chalo. Choose the correct pair. Okay, choose the correct pair over here. Ferrous sulfate, is it your toxic antiseptic? Toxic antiseptic. Aluminium hydroxide gel denitrifies. Zinc oxide astringent, or calamine, that's your antacid. Obviously, it is going to be your zinc oxide, which is your astringent in nature over here. Okay? So, now, this one. Vitamin E deficiency can cause. Vitamin E deficiency can cause elevation of calcium levels in blood, sterility in male rats, elevation of serum phosphate, scurvy in humans. Now, vitamin E deficiency can cause your sterility, right? Cause your sterility in male rats. Okay, so these going to be a correct answer. Now this one, mechanism of action of the tacrolimus is similar to, is it your cyclophosphamide, cyclosporin, azathioprine, or mycophenolate mofetil? What's that? So tacrolimus, as well as if I talk about cyclosporin, these are considered to be as your calcineurin inhibitors, right? Which is considered to be as your immunosuppressant, right? Immunosuppressant, right? So this is going to be your correct answer. That's your cyclosporin over here. Okay. So now this one. One of the following anticoagulants is safe using pregnancy. Warfarin, no. Very much teratogenic. Dabigatran, Teratogenic. Low molecular weight heparin, yes. This is, you can say, like very much safe in your pregnancy as well. Okay, sure. Which of the following is not used to lower down the triglyceride into the blood? Okay, which is not used to lower down the triglyceride into the blood? That's a nice question. Niacin, yes, obviously. Rosuvastatin, you know it. Rosuvastatin, atorvastatin, pravastatin, right? Fenofibrate, yes. PPAR, alpha activity. Cholestyramine doesn't use to lower down the triglyceride. Okay, chalo. Which of the following is an analeptic? Okay, that's a nice one. Analeptic is considered to be as a respiratory stimulant if you talk about respiratory stimulant. Is it your cocaine, methylphenidate, doxapram, or modafinil? Yeah, that's your doxapram guys. Okay, doxapram is considered to be as an analeptic. That's a respiratory stimulant. Okay, now selagelin, resagelin. As I already told you, selagelin as well as resagelin. These are considered to be as your MAO P inhibitor, right? MAO P inhibitor. Selective irreversible monoamine oxidase inhibitor, obviously, right? A is going to be your correct answer over here. All right. So I think, yeah, this is all about the pharmacology section, Anna, and the other faculties members will be taking their respective subject. And thank you so much for being there with me right now till the end. And do let me know into the comment section that how many questions of all these kinds of questions that we have, 120 questions, you got right. All right. Thank you so much.
Yes, so let's start with the pharmaceutical section. Okay, so the first question that is on your screen is, which of the following is an ex officio member in the PCI? So they are mainly asking about the ex officio member of PCI. Option A is a representative of UGC, University Grant Commission, the Director General of Central Drug Laboratory, which can also be known as CDL. Okay, the third option is a representative of All India Council of Technical Education, and the D option is Director of Medical Council of India. So as we know, there are three ex officio members. Three ex officio members. Okay. So one of them is mainly what? Director General of Health Services. One is going to be the Director Drug Controller General of India, and three is mainly going to be the Director of CDL, that is going to be the Central Drug Laboratory. So yes, the option B is mainly containing the Director of Central Drug Laboratory. So it's going to be the correct answer for that particular question. Moving towards our next question. So this is the definition. Okay. So as per of Narcotic Drug and Psychotropic Act substance in 1985, the punishment for the contravention in relation to the commercial quantities of opium poppy. Okay, they are mainly asking about the opium poppy and the opium involves. Option A is imprisonment not less than for 6 months, imprisonment not less than for 5 years, imprisonment not less than for 10 years, and imprisonment not less than for 1 year. So in case of drug and narcotic and psychotropic substance, whenever there is a thing that are related to particularly the substance that are very addictive in nature or producing certain chemicals that are very addictive in nature, like opium poppy, okay, the poppy straw and the different kind of things that are being isolated from the opium poppy are very addictive in nature. That's why the imprisonment and the fine that is capped for that particular plant should be high, and it is, the imprisonment is of 10 years, and the minimum fine for that particular commercial quantity contravention of the particular narcotic and psychotropic substance act 1985, it is 1 lakh rupees, but the imprisonment should not be or is not be less than 10 years. So option C is going to be the correct option, correct answer for it. Okay. Yes. Moving towards our next question, a price fixed by the government on the scheduled formulations in accordance with the provision of the drug price control order is known as. So as implied of that DPCO, that is mainly what they are, drug price control order. So there is a price that is fixed by the government for the scheduled formulation or for the formulation that are being utilized by majority of the population is known as. Option A is ceiling price, option B is retail price, option C is maximum retail price, and option D is wholesale price. So the price that is being fixed by the government for certain medications that are needed by the majority of populations under the DPCO Act in order to generalize the amount or the price that has to be paid for that given drugs, and should make these drugs available to the normal population or poor populations as well. So the maximum amount of price that is being fixed by the government for that kind of drug is known as ceiling price. As it indicates, ceiling is a term which is showing the highest, so it is the highest price for that particular drugs that is being decided by the government. Okay, so see, A is going to be the correct answer for that particular question. Okay, yes. Moving towards our next question, the 34th question is saying the Drug and Cosmetic Act DNC Act, a drug shall be deemed to be superior. So they are mainly asking about superior drug. Option A is if it consists a whole or a part or a flithry, putrid and decomposed substance. Option B is it is not labeled in a prescribed manner. Option C is if it contain a harmful as well as toxic substance which may render it injurious to the health of human being. And option D is if it is imported under the name which is belong to that of the other drug. So what kind of drug is mainly known as superior drug? So whenever there is a false talking, whenever there is a false talking is occurring in any case, this is mainly related to the superior drugs. Okay, so in which option there is a false talking is mainly occurring and false feeling, okay, of the things that are related to the drug is occurring in the case of superior drug. So what option is correct for that particular question? The import of drug if done under the name of drug that belongs to the another drug. We are importing a different drug but are imported under the name of some other drug, so we are mainly producing something misleading or will mainly communicating something false to that of the government. That's why it comes under the category of superior drugs. Okay, so D is going to be the answer. Coming towards our next question, as per of DNC Act, Drug and Cosmetic Act, the regulations and the standards for the vaccine. So vaccine are mainly considered under the biological products. Biological products that need to be stored at a very low temperature are included under option A is schedule 2 F2, option B is schedule F1, option C is schedule F3 and option D is schedule F5. So F5 is no schedule. There is no schedule with the name of F5 exist, but there is schedule that is FF, that you can also remember by double focus. Okay, double focus. So double focus is mainly done by the eyes. So schedule double F is for the eye preparations. Okay, yes. The schedule F2, F1 and a different kind of schedule. So F1 is the schedule that is related to the biological products. Yes, is for the vaccine. So B is going to be the answer. But the schedule F2, as it's indicate, there is a tape having two ends of it. So it is mainly, F2 is mainly for the surgical dressing. Surgical dressings. Okay. And the schedule F3 is mainly for what? The umbilical tapes. Okay. So these are all the class that of the schedule F we have discussed. Okay. So B is going to be the correct answer for that particular question because they are asking about the biological product, that is vaccine. Okay. Coming towards our next question, that is question 36. One of the following ingredients is added to the toothpaste formulation to prevent the paste from drying out, okay, or hardening under the unacceptable conditions. So somewhere it is mainly retaining what? Moisture. Retaining what? Retaining moisture in the paste formulation or in the toothpaste formulation. And the thing that retain moisture in a given toothpaste formulation or any other formulation is known as humectants. Humectants. And there are very known example of humectants are glycerine can be a humectant that retains the moisture, sorbitol can be a humectant, propylene glycol can be a humectant. Okay, propylene glycol can be a humectant, and there is another thing, etc. or other things can also be a humectant, but they are the major example or the main example or common example for humectant that retains the moisture and will mainly prevent the drying out of certain things. So option A is calcium carbonate. No, this is not the answer. Option B is sorbitol. Yes, option B is going to be the correct answer because sorbitol is the kind of humectant that is mainly utilized in order to retain the moisture and will mainly protect the given formulation from drying out. Okay, but there are some other components of that particular paste as well. So they can be the binders are also present in the paste, abrasive agents are also present in the paste, abrasives we can say. Okay, and we can say like detergent for forming actions. We have to, okay, and then preservatives. Preservatives are also present. Sweetening agents are also present. Okay, and active ingredients like anti-caries agent, etc. Active ingredients are also present. Active ingredients, preservatives, okay, and sweetening agents, and sweetening, we can also say like flavoring agent and sweetening agent. Flavoring agent are belongs to the same category. So all the other components that are should be present into a paste formulation, into a toothpaste formulation. So B is going to be the correct option or the answer. Okay, the mascara is applied. The mascara is mainly applied to which part of our body? Like we know eyes, to which part of our eye? Either the eyelashes, okay, either the eyelids, either the eyebrows, or either the lips. So lips is not going to be correct. So we have to answer from the A, B, and C. So which option is going to be correct for that particular question? Yes, the mascara, in order to tilt, in order to alter, in order to improve the appearance of our eyelashes, we are mainly utilize that mascara. So I am asking you a question: which kind of pigment are being used? Okay, and in which concentration for the mascara preparation? So eyelashes is the part where the mascara is being used. So A is going to be the option, not the eyelid, not the eyebrows. Okay, so moving towards our next question. One of the following ingredient is used to increase the residence time of the ophthalmic solution. So if the residence time is increasing, the ingredient must be increasing the viscosity of that formulation. That particular ingredient is mainly increasing the viscosity of given formulation. Okay, and the second thing, it have been producing or mainly increasing the residence time, okay, is its mucoadhesive property. Mucoadhesive property is also going to be increased. Okay, so option A is benzalkonium chloride, option B is hydroxypropyl methyl cellulose, that is HPMC, we know it by a name of, that is a kind of polymer. Okay, option C is benzalkonium chloride, and option D is sodium metabisulfite. Yes, HPMC, hydroxypropyl methyl cellulose, is a kind of polymer that is mainly related to increment in the viscosity of the ophthalmic solution. As the viscosity increase, the residence time of that particular ophthalmic solution is also going to be increased, and it also have a property of increasing the mucoadhesion. More the adhesion, more the absorption. So in turn will mainly increase the bioavailability or absorbability of that particular drug through the eye. Okay, or absorption through the eye. Okay, so HPMC is going to be the answer for that particular question. Okay, okay. So moving towards our next question, the hydrous lanolin is an example of oil in water emulsion ointment base, oleaginous ointment base, okay, and water miscible ointment base, or water in oil type of emulsion base. So oil in water is a kind of hydrophilic base they are talking about, okay. And if they are talking about water in oil type, they are mainly talking about lipophilic emulsion bases, lipophilic things. So hydrous lanolin, okay, hydrous lanolin is the first example we can consider. So hydrous lanolin is a kind of, which kind of base? The water in oil type of emulsion base. Yes, water in oil type of emulsion base is a kind of lipophilic base. The other example of it is, first is hydrous lanolin, the second is going to be the lanolin itself, okay, and the third is mainly going to be the cold cream, eucerin. Okay, cold cream is also example of it. The eucerin this can be also the example of it. The oil, water in oil type of, or the lipophilic type of emulsion base. Okay, and the aquaphor, that will also aquaphor. Okay, so the aquaphor, the eucerin, the cold cream, the lanolin, and the hydrous lanolin are the example of water in oil type of ointment emulsion. So D is going to be the correct answer. Okay. Coming towards our next question, which of the following are used to measure the melting time of the entire suppository? So they are mainly asking about the melting temperature of the entire suppository. The micro melting range test, second is softening time test, third is macro melting range test, and the liquefaction time test. Yes, for the measurement of the entire time or the complete melting of suppository. That particular test is being done in order to measure that how much time a given suppository will take in order to melt in a particular, or when the given suppository is placed in a particular body cavity, then how much time it will take in order to melt whole of its content. Okay, so the test that is being utilized in that particular, for that particular purpose, is going to be what? The macro melting test. The macro melting test. So there are other tests also utilized in order to check the suppositories, and also the content uniformity test, the melting point test, okay, the manipulability test, and there are different kind of other tests that are also being utilized in order to check the suppository performance and its making or its efficacy. So C is going to be the answer. Option C is going to be the answer. Moving towards our next question, one of the following statement is true about the aqueous solubility of a drug. So we have to find the true statement. Option A is aqueous form has a lower solubility than that of the crystalline form. No, amorphous form, sorry. Amorphous form having a lower solubility as compared to the crystalline form. No, never. Amorphous form is a high energy form, higher energy form, or is a kind of random form. Okay, and there is no crystal lattice, no crystal lattice in it. So there is no energy will be needed in order to break the crystal lattice, and all the things, all the molecules are present in the random order, and also they having a higher amount of energy, so lesser amount of energy is required in order to solubilize them, because solubilization is a kind of endothermic process. So this statement is not going to be correct. Option B is anhydrous form has a lower solubility than the hydrates. Anhydrous form is always having a higher solubility because they have a tendency, more tendency to get water as compared to the hydrate, because hydrates are the form that already has water in it. Okay, so this is also going to be correct or incorrect, sorry. Okay, so hydrate already have water, that's have lesser tendency to mix with that of the water when we compare that hydrates with that of the anhydrate forms. Okay, the metastable polymorphs are greater solubility than that of the stable. Yes, the metastable polymorph having a greater solubility because the order of stability are somewhat in this form. The most unstable is the amorphous, then we come to the metastable forms, okay, and then we comes to the stable forms. Okay, this is mainly the stability order, decreasing order of stability. The most unstable is the amorphous, then comes the metastable, and then comes the stable. Yes, so C is going to be the correct answer. The hydrate having the greater solubility than the organic solvate. No, the solvate is always having a greater solubility because they do not have any water molecule associated with them, but the hydrates have. That's why the hydrates have a lesser tendency of solubilization. So C is going to be the correct option, and we are moving towards our next question. Okay, the 𝙁 test. The 𝙁 test is done for the parenteral, is usually performed at the condition for the 𝙁 test. Option A is going to be the 37 degrees Celsius for 120 minutes. Option B is 25 degrees Celsius for 60 minutes. Option C is 37 degrees Celsius for 180 minutes. And option D is going to be 37 degrees Celsius for 60 minutes. Yes. Okay. The condition for that given 𝙁 test and the definition and the full form of that 𝙁 test is mainly, it is mainly isolated from the horseshoe crab. Okay, and the definition of that 𝙁 is 𝙂𝙂 amniocytic lysate is a kind of enzyme. Okay, 𝙂𝙂 amniocytic lysate, that is mainly isolated from where? Horseshoe crab. And the condition that is provided for that particular 𝙁 test is the 37 degrees Celsius for how much time interval? 60 minutes. And for what that particular 𝙁 test is being done? It is being done in order to detect the endotoxins. If there is a presence of, if there is a presence of endotoxins, then turbidity will going to be increased. Okay, turbidity is going to be increased for that particular solution. Otherwise, turbidity is not going to be increased for that particular solution. Okay, so option D is going to be the correct answer for that particular question. So there are different other tests that can also be done for the parenteral. That can be the isotonicity test, the pH test. Okay, uh, uh, the pyrogen test, the sterility test, the particulate matter test. Okay, so these are some other kind of tests that are also utilized for your parentals. Okay, so C D is going to be the correct option. Moving towards our next question, the total parental nutrition emulsion is administered via subcutaneous route, intramuscular route, intraperitoneal route, or intravenous route. The TPN, that is also known as total peripheral nutrition or total parenteral nutrition. So it is a higher amount of the liquid that is for an adult is about 1 to 3 liters a day. That is mainly given by the IV route, intravenous route. Okay, IV route. So that much amount of solution, that a higher or a bigger amount of solution that is given for the patient that are under the serious condition or not even taking food in their body. So we have to apply or we have to associate them or connect them to the total parental nutrition having its value 1 to 3 liter a day and given by the IV route. So D is going to be the correct option of it. Moving towards our next question, in a sugar coated tablets, okay, the desired color to the tablet is imparted during. So I am asking here you a question that how much time the different kind of tablets are taking in order to get dissolved. Okay, for the sugar coated tablet, how much time it will take? Okay, for the effervescent tablet, for the dispersible kind of tablet, how much time they are taking? So option A is going to be the smoothing, option B is subcoating, option C is sealing, and option D is finishing. Okay, so for what purpose or where the steps or in what step of the process of sugar coating we are mainly adding color to it. We are mainly adding color to it. So we are mainly known as the syruping, the syruping, or we can also say that it is smoothing. Smoothing is the process where the color addition is takes place. So smoothing is given here, so is going to be the correct option. If we are talking about what the sequence is in this way. First the sealing is being done, then the subcoating is being done. After subcoating, we have to apply the syruping or smoothing, the syruping or smoothing. Okay, so either the coloring step or the colorant is being added in that particular step, or we can also consider it in the next step. Okay, in the next step of color addition, coloring, and then the final step is going to be the polishing. Okay, so this is the flow diagram of your sugar coating process. So A is going to be the correct option. Okay, then we come to the another question: which of the following is not used as a solvent in nail lacquer remover preparation? Option A is going to be acetone, option B is ethyl acetate, option C is hexane, and option D is going to be what? Isopropyl alcohol. So the polarity index for that particular hexane is going to be 0. So it is a kind of solvent that are not being utilized in order to remove the nail lacquer, but the acetone, the ethyl acetate, and the isopropyl alcohol are well known to be utilized as a nail lacquer removal preparations, but not the hexane because its polarity index is 0 or its polarity is 0, so it is not utilized for the removal of that nail lacquer because it is not solubilized or able to solubilize that particular nail lacquer due to its polarity. Okay, then comes to the another question. The zinc pyridine is commonly used in shampoo preparation. Option A is the conditioning agent, option B is the foam stabilizer, option C is the opacifier. The opacifier, well known, is the titanium dioxide. And the anti-dandruff agent, yes, the zinc pyridine is mainly used as an anti-dandruff agent. So D is going to be the correct option. We have to learn other anti-dandruff agent as well. So first is going to be zinc pyridine. The second one can be the salicylic acid here. Salicylic acid. Okay. The third one can be the ketoconazole. That can also be the antifungal ketoconazole. Okay. And they can be the selenium sulfite. Selenium sulfite. Selenium sulfite. So this can be important. Okay, and zinc pyridine is important, are mainly utilized in our shampoo preparation for their anti-dandruff action. So D is going to be the correct option. Moving towards our next question, the 47th question, which of the following is used to determine the size distribution in a particular or the particles that are present in the suspension, because suspension having the particle that are suspended in them. Option A is photon correlation spectroscopy. Option B is nitrogen adsorption isotherm. Option C is the liquid displacement method, is mainly done for what? For the true density determination. Okay, or for the surface area determination, and the air permeability method is also for the surface area determination. The only thing that left here is the PCS. PCS, that is photon correlation spectroscopy, that is also known by the name of what? By the name of DLS. DLS is mainly dynamic light scattering, microscopy. Okay, so the photon correlation spectroscopy is also being known by the name of DLS, that is going to be what? The dielectric light spectroscopy. So A is going to be the answer for that particular question, and this PCS or the photon correlation spectroscopy is mainly utilized to check the particle size distribution in a powder sample. So A is going to be the correct option. Moving towards our next question, if a solid is non-porous in nature, okay, then what is happen, or then what is true statement for them? Option A is the true density is greater than that of the granular density. Okay. Option B is the granular density is greater than the true density. Option C is the true density and the granular densities are equal. And option D is the ratio of true density and the granular density is 0.5. So the only point that is making sense here is a particular particle that is non-porous in nature. So what is true density? The true density is the density of the particle itself, and the granular density is the density of the particle itself, particle density. Okay, plus the void spaces that are present in them is also included in that particular granular volume. What kind of volume spaces are included in it? That are the intraparticular void spaces. So if they are asking about the particle is non-porous in nature, so this intraparticular void spaces, that we can say this is a kind of intraparticular void space is not present here. So we can say that true density is equal to that of the granular density for that particular case when the particle is non-porous in nature. Yes, so C is going to be the correct option of it. Moving towards our next question, which of the following having the lowest HLB value? Okay, option A is antifoaming agent, option B is the detergent, option C is the solubilizing agent, and option D is what? The wetting agent. Okay, so we have to find out which of the following will having the lowest HLB value. So we have to consider like 1, 2, 3. Okay, 1, 2, 3. Then we have to done 3 to 6. Then we have to done 7 to 9. Okay. So 1 to 3 HLB value is mainly for the antifoaming agent. Okay. And the 3 to 6 value is mainly for the oil in water type of suspension or emulsifying agent. Okay. And the 7 to 9 value is mainly for the wetting agent. Okay. Then we come to the 8 to 18. That is for what? That is for oil in water type of solubilizing agents. Okay, then we come for 13 to 15 value and 16 to or 15 to 18 value. So 13 to 15 is mainly for the detergents we are used to wash our clothes. Okay. Yes, detergent we use to wash our cloth, and the 16 to 18 value is mainly for solubilizing agents. So they are mainly asking about the lowest value. Yes, the lowest value is for the antifoaming agents and the highest value is for the solubilizing agents. So answer for that particular question is going to be A option. Then we comes to the Bingham bodies. Okay, the question 50th question is the Bingham body exhibit which kind of flow. So they are mainly asking about which kind of flow is mainly exhibited by that Bingham bodies. The Bingham body will mainly exhibit. Option A is going to be the pseudoplastic flow. Option B is the dilatant flow. Option C is the Newtonian flow, and option D is the plastic flow. So the Bingham body, that is also known by the name of what? Plastic bodies. That is also known by the Name of plastic bodies. Plastic bodies. And what is the characteristic feature of these plastic bodies? The plastic bodies are the bodies that do not flow, don't flow, or do not flow until until or up to a condition when the force applied exceed a particular force. Okay. So plastic bodies are also known as the Bingham bodies. But for the Newtonian, okay, where is Newtonian? Is it? Okay. But for the Newtonian, the shear stress is directly proportional with that of the shear force that is applied. If we increase the shear force, then the shear stress is also going to be increased. But for the dilatant, but for the dilatant, we are mainly, if the shear stress increases, then the viscosity is also going to be increased. And reverse is true for what? Pseudoplastic. For the pseudoplastic, if the shear stress is increased, then what? Viscosity is going to be decreased. Yes. So by the name we know that the Bingham bodies are also known as the plastic flow, and we are also discussed about some of the important points that can be asked in your exam and are related to different kind of flows. Okay, you have to learn their example as well. Moving towards our next question, the clathrates is the kind of channel-like structures, the cage-like structure, the layer type of structure, or the what? Channel lattice type of structures. So the cage structure, clathrates, in the pre-formulation study, whenever there is a formation of non-stoichiometric complex, so there is a formation of what? Clathrates. The clathrates are mainly the cage-like structures. The clathrates are the cage-like structure. They are mainly given in that particular that kind of structure. Okay, in which the molecules are entrapped here, 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 and here in different directions. So clathrates are mainly the cage-like structure. Option B is going to be the correct answer. Moving towards our next question, the half-life of the second order reaction is directly proportional to the initial concentration of reactant, independent to the initial concentration of reactant, the inversely proportional to the square of the initial concentration of reactant, and the D option is going to be what? The D option is going to be inversely proportional to the initial concentration of the reactant. Okay, so we have to first write the equation for the half life that is related to different type of reaction. So for a zero order reaction, the T half can be written as, okay, the T half for the zero order reaction can be written as C naught, that is the initial substrate concentration, divided by 2K. For the first order reaction, the T half can be written as 0.693 divided by K, and for the second order reaction, the T half can be written as what? 1 by K C naught. So they are asking about the second order reaction. So inversely proportional to the initial concentration, D is going to be the correct option. If they are asking about the initial concentration independent, they are asking about the first order in that. So for that particular question, D is going to be the correct option. Moving towards our next question, which of the following is commonly used in water in oil type of emulsion or as an emulgent? Okay, option A is polyethylene sorbitol monoleate. Okay, option B is the triethanolamine oleate. Option C is the acacia, and option D is going to be what? Option D is going to be here the sorbitol monoleate. Yes, for the water in oil type of emulsion, it should be of what nature? It should be of lipophilic nature. So which HLB value should it having? The HLB value of it should be lies in a range of 3 to 6. Yes, for that particular water in oil type of emulsion, that is going to be lipophilic in nature. Okay, and what they are mainly producing? They are a kind of non-ionic surfactants. Non-ionic kind of surfactant. And what, as they are surfactants, what thing that they are doing? They are mainly decreasing the interfacial tension. And in turn will mainly facilitate the mixing of the one component that is mainly hardly visible into that of the other. So D is going to be the answer. Sorbitol monoleate is that kind of compound. So moving towards our next question, The roller compactor. The roller compactor is the instrument that is being used in a wet granulation process, in a dry granulation process, in a direct compression process, or in a drying process, or not in a drying process. So whenever there is a formation of large sheets of that given API, these large sheet of given API are also known as what? Sludge. Sludges. So these sludges are mainly formed by what? The roller compactor. And these sludges is only formed in the case of what? Dry granulation. Okay, these sludges will only form in the case of dry granulation. So B is going to be the correct answer. The moisture content they are asking about in the 55 question, the moisture content of the hard gelatin capsule shell should be in a range of, yes, for the hard gelatin capsule, the moisture content is somewhere high or lies in a range of 13 to 16% weight by weight. Okay, but if they are asking about soft gelatin capsule, that's why they are more brittle in nature, but they are soft as their name indicate. Soft gelatin will having their moisture content that should be lies or in between 6 to 10%. So A is going to be the correct answer because they are asking about the moisture content of that particular hard gelatin capsules. Okay. Moving towards our next question, a mixture of organic acid to that of the sodium carbonate that is given by the formula NaHCO3 is commonly used in the formulation of. Option A is the chewable tablet, option B is the sublingual tablet, option C is the lozenges, and option D is the effervescent tablet. So the organic acid will mainly react with that of these sodium bicarbonate and will mainly leads to the formation of sodium salt of that particular organic acid, and also formation of CO2 that will evolve out of the reaction and the water itself. So as the reaction is conducted in water, so water is not making any sense here, but the evolving gas that is mainly the CO2 will mainly create the brisk effervescence or a hiss sound that is mainly an indicator of what kind of tablet or leading to the disintegration or disruption of the tablet structure. So is a kind of effervescent tablet. CO2 evolution is mainly done in that particular case. So D is going to be the answer. Moving towards our next question, one of the following aerosol container is not suitable. They are asking about the container is not suitable for the high pressure aerosol formulation. The tin free steel container, option B is the aluminum container, option C is the stainless steel container, and option D is the uncoated glass container. So the uncoated glass container is not going to be suitable because there are certain things that are related to that of the uncoated container. Firstly, it is uncoated and should having the explosion potential or explosion hazard, we can say, is associated with it. Okay, the second third is it is particularly brittle in nature. Okay, and the third thing is it is non-protected as it is non-coated. So the uncoated glass container is not being used, and it is very brittle because it is mainly made up of glass and we are mainly utilizing it for the high pressure aerosol formation. So that's why we can't be able to utilize that particular glass containers or that particular uncoated glass containers for that particular high pressure aerosol formulations. So D is going to be the correct option. Coming towards our next question, is an aerosol bottle valve assembly the Derlin is made up of or used to. So we can remember it with the trick like Derlin cloths. So it's a brand that will make cloths. So the cloth that we wear in our house, we should wear cloth in our house. So to make housing, we are mainly use the Derlin. Okay, so he is going to be the correct option of it. The other part of that particular bottle valve assembly can be the actuator, can be the valve, can be the spring, can be the gasket, can be the dip tube itself, and the mounting cap are the different examples or the different names or the parts of that particular aerosol valve assembly. Okay. Coming towards our next question, which of the following statement is true? We have to find the true statement. Option A is the serum creatinine is a biochemical marker to measure the hepatic clearance. Okay, the aminoglycoside is prescribed at a higher dosage during the renal failure. This is not correct. This is not correct. Estimated GFR. GFR means glomerular filtration rate. Is used to maintain or in the maintenance of the drug dose adjustment in a chronic renal failure. So yes, we have to mainly estimate what amount of filter that the given glomerular unit is filtering out in order to decide the drug dose that we are given to that of the patient that is mainly suffering from the chronic renal failure. Yes, so this is going to be the correct option. And the option D, the estimated GFR is used to maintain the drug dose adjustment in liver cirrhosis. No, the GFR is mainly related to the kidney. It is mainly related to what? It is mainly related to kidney. So why they are mixing it with the liver? So this is not correct, this is not correct, this is not correct. So C is the option. Okay. Yes. One of the following is not utilized for the calculation of absorption rate constant for plasma data. Option A is going to be the Wagner-Nelson method. Option B is going to be the sigma minus method. Option C is the peeling technique, and option D is the filtering technique. Okay, so mainly the sigma minus method is not going to be utilized in order to calculate the absorption rate constant, because the sigma minus method is mainly used to determine the PSD, that is mainly the particle size distribution. The particle size distribution is mainly defined by or given by the sigma minus method. So we have to find the odd one out of them. So B is going to be the correct option. Coming towards our next question, the minimum number of half-lives that are required to reach a given drug or the steady state plasma concentration. We can say a constant plasma concentration. Constant plasma concentration after continuous infusion of the maintenance dose of that particular drug. So yes, after 5 half-lives, okay, the plasma will mainly reaches to a plateau phase, plateau condition. So after 4 to 5 half-lives, the plasma will reaches to a plateau phase. Okay, so yes, we can say like this is the half-life, this is the reaction going on, this is the half-life, and this is the half-life, and this is another the half-life, the first half-life, the second half-life, the third half-life, the fourth half-life, and that of the fifth half-life. That will make it plateau or the constant. Okay, so 4 to 5 half-lives are needed in order to maintain a steady state of that plasma concentration of that particular drug that is being infused or should be infused to the 5 half-life. So this is all about or all the questions that are related to your pharmaceutical section. Thank you so much for giving your precious time. I hope you guys enjoyed that particular section explanation. Thank you so much for giving your time.
Hello everyone, welcome to the GDC English YouTube channel. So, in today's PGECET 2018 question paper, we are going to discuss the pharmaceutical chemistry portion. Okay, so let's start with the question. Question number one. What the question number one is saying? Very simple question. If you guys just remember the classification of the anti-cancer drugs, then you can solve this question. What the question number one is saying? Choose the correct pair. We have to identify the correct pair among themselves. The first option is your methotrexate alkylating agent. Second option is your cyclophosphamide antimetabolites. Third option is your doxorubicin, that is topoisomerase 2 inhibitor, and the fourth option is your vincristine, that is protein kinase inhibitor. So we have to find which one of the following is the right answer. So let's start. The first one is they have given methotrexate as an alkylating agent. Is this a right answer? Methotrexate with an alkylating agent? No, methotrexate is not an alkylating agent. It comes under which class? Methotrexate is an anti-metabolite, that is DHFR inhibitor. Okay, it is not an alkylating agent. If we talk about the cyclophosphamide, cyclophosphamide is an alkylating agent. It is not an anti-metabolite. Next is your what? and it comes under which class? Nitrogen mustard class, cyclophosphamide. Now if you talk about the doxorubicin, yes, doxorubicin is a topoisomerase second inhibitor, and it also intercalates what? It also intercalates the DNA, and that generates the free radicals. And also remember that doxorubicin causes what? It causes the cardiotoxicity. Remember these points, these are very important points. Next one is, or if you talk about the vincristine is a protein kinase inhibitor? No. Vincristines are your vinca alkaloids, and how they act? They bind with the tubulin, and that represent in a that inhibits the microtubule polymerization, that is mitotic spindle poison there will be, and it is not a protein kinase inhibitor. Okay, now again, if we talk about, we have seen that the correct answer is option number C, and I have told you guys that doxorubicin is what? It is a cardiotoxic. So how to manage the cardiotoxicity of the doxorubicin? So in order to manage the cardiotoxicity of the doxorubicin, there is a one drug named as dexarazoxane, that is known as dexarazoxane. Okay, one drug named dexarazoxane. Okay, and this is what? This is an iron chelator, and it is used to manage the cardiotoxicity caused by your doxorubicin. And what are the other topoisomerase 2 inhibitors? Namely your etoposide and tinopsides are also there. So the correct answer is your option number C. Next question. When compared, if we compare the acetylcholine, the acetyl A-methylcholine has, okay, we have to compare the values of acetylcholine with acetyl A-methylcholine. The first option is your greater nicotinic and muscarinic activity. The second option is your greater nicotinic and less muscarinic activity. The third option is your less nicotinic and greater muscarinic activity. And if we talk about the decreased nicotinic and muscarinic activity. So if we talk about now acetylcholine and acetyl alpha methylcholine. So here as what? One alpha methyl group is extra in alpha methylcholine, and that one methyl group on the choline part creates what? It creates the steric hindrance, and due to steric hindrance, it reduces its fit at nicotinic receptors, and that results in what? And that results in its less nicotinic activity. And again, muscarinic and if you talk about this methyl substitution, the muscarinic receptors are more tolerant for these methyl substitution. That's why it will result in greater muscarinic activity. Okay, so it will result in what? It will result in less nicotinic and greater muscarinic activity. So the correct answer for this question will be your option number C, that is the less nicotinic and greater muscarinic activity. Okay, no, the correct answer is your option number C, not option number D. Okay, next question. Propranolol, that is alpha beta blocker. Propranolol is what? Propranolol is your alpha beta blocker, and it is synthesized from what? The first option is your 1-naphthol epichlorohydrin. The second option is your 2-naphthol propylamine. The third option is your 1-naphthol and methyl pipechloridine, and the second last option is your 2-naphthol and isopropylamine. So propranolol, that is your beta blocker, it is correct. It is synthesized from what? The starting material for the synthesis. So the starting material for the synthesis of propranolol is what? Is your 1-naphthol and epichlorohydrin. What happens here when we, let's understand this, when we combine 1-naphthol with epichlorohydrin, it will result in formation what? It will result in formation of your glycidal ester. It forms what? It forms your glycidal ester as an intermediate. Glycidal ester is formed as an intermediate, and that glycidal ester then react with what? That glycidal ester then react with your isopropylamine. Then that glycidal ester will react with your isopropylamine, and when they react with this isopropylamine, that will result in formation of what? That will result in formation of your propranolol, that is your alpha blocker. So the correct answer for this question will be your option number A, that is 1-naphthol and epichlorohydrin is the right answer. And if you talk about the beta blocker, propranolol is your non-selective beta blocker, that is beta 1 plus beta 2, and it is also highly lipophilic in nature, and it can crosses your blood-brain barrier. Okay, so next question. Chemical name of diphenhydramine. What is the chemical name of your diphenhydramine? The first option is your 2-phenyl ethoxy N dimethylenamine. The second option is your 2-diphenyl methoxy N diethyl ethanamine. The third option is your 2-diphenyl methoxy N dimethyl propranamine. And if you talk about 2-diphenyl methoxy N dimethyl ethanamine, so what will be the right answer? So the chemical name of your diphenyl hydramine is 2-diphenyl methoxy and dimethyl ethanamine. What happens here? Like if you talk about this breakdown, that is 2-diphenyl methoxy and dimethyl. Okay, and this is what, this is your diphenylhydramine is your first generation H1 antihistamine, and it can causes what, it can causes the sedation, it has the sedation. Okay, so the correct answer for this question is your option number D. Okay, next question, imipramine. Imipramine is, what is the imipramine? The option number A is reversible inhibitor of MAO-A, that is your RIMA. The second option is your serotonin transport inhibitor, that is SERITI. The third option is your selective norepinephrine transport inhibitor, and the last option is your selective non-epinephrine reuptake inhibitor. So what is the imipramine? So imipramine comes under which class? Imipramine, what? Imipramine is a tricyclic antidepressant, and it inhibits what? It inhibits both serotonin and norepinephrine reuptake inhibitors are there. So the correct answer for this question will be your option number B, that is serotonin transport inhibitor. The correct answer will be option number B. Okay, next question. Question number 67. What are the question number 67 is saying? Diphenylhydrantoin. Diphenylhydrantoin is prepared by the reaction of. Okay, so what is the starting material? So in medicinal chemistry, you have to focus on the, don't go much deeper in the synthesis. Just focus on what? Just focus on the static materials of the synthesis. Okay, so diphenylhydrantoin, that is your phenytoin. So what is the static material for the phenytoin? The first option is your benzyl and thiourea. The second option is your benzyl and urea. The third option is your benzoin and thiourea, and the last option is your benzoin and urea is the right answer. So what will be the right answer? A, B, C, or D? So the starting material for the phenytoin is what? Is your benzyl and urea. What happens here? When these benzyl and urea, it gets heated with NaOH. When benzyl and urea got heated with NaOH, it's known as what? It's known as 𝘿𝙬 synthesis. What is the name of this synthesis? 𝘿𝙬 synthesis. Okay, the name of this synthesis is 𝘿𝙬 synthesis. Then it's heated, when these benzyl and urea gets heated with your NaOH, it will result in formation of your diphenylhydrantoin, that is known as what? That is known as your phenytoin. Okay, simple. And it is what? It is the, involves the benzylic acid rearrangement. There is what? Benzylic acid rearrangement, and at that there is the cyclization is there. Okay, so I hope these points are clear. Okay, so next question number 68. What the question number 68 is saying? Methicillin is, what is the methicillin? Okay, so methicillin is, option number A is sensitive to inactivation by penicillinase. Option number B is resistance to inactivation or by moisture. Option number C is resistance to acid, that is pH of about 2. Option number D is sensitive to inactivation by moisture but resistance to penicillinase. Okay, so what is the methicillin? Is A, B, C, or D? So if we talk about the methicillin, methicillin is designed with a bulky group. It has a bulky group, that is 2,6-dimethoxyphenyl group. It has what? 2,6-dimethoxyphenyl group, and that creates what? That creates a steric hindrance. That's why the penicillinase, that is your beta lactamase, cannot access to that beta lactam ring. Why? Because it has a bulky group, that is 2,6-dimethoxyphenyl group, and that's why it creates a steric hindrance, and due to which your penicillinase, that is your beta lactamase, cannot access that beta lactam ring, and that make our what? That makes it resistance to penicillinase. Okay, so it is a resistance to penicillinase, but it is sensitive to inactivation. Why? Because that bulky group is acid labile, that's why it is moisture sensitive. So the correct answer for this question will be your option number D is the right answer, sensitive to. Okay, and in case of there is methicillin, in case of here methicillin resistant staphylococcus aureus, it is given to the, for the treatment of staphylococcus aureus. So in case of MRSA, that is MRSA, methicillin resistance staphylococcus aureus, which drug is given? We give the linezolid and vancomycin. Vancomycin mostly we give in the case of MRSA. Okay, vancomycin. Then after the vancomycin, that will result in MRSA, that is vancomycin resistant staphylococcus aureus. Then we will give the linezolid. So the correct answer for this question will be your option number D will be the right answer. Okay, next question. Beta-acyl-aminoethyl moiety. Beta-acyl-aminoethyl moiety is present in the following sulfonylurea class of hypoglycemic agent. Okay, so this moiety is present in which sulfonylurea class of your hypoglycemic, that is for the treatment of the your diabetes? So the correct first option is your tolbutamide. The second option is your glyburide. The third option is your gliclazide, and the fourth option is your what? The fourth option is your carbutamide. So which of the following is the right answer? So the correct answer for this question will be your option number B, that is glyburide. What is the glyburide? Glyburide is your second generation sulfonylurea, and it has the beta amino ethyl moiety present at side chain of the benzene ring. Beta amino ethyl as a side chain of benzene ring. And what is why? And this your beta as acyl amino ethyl moiety is the distinguished feature between the first generation and second generation sulfonylurea. And if you talk about this glycoside is also a second generation, but it has a aja bicyclo ring. It has a what? It has a as a bicyclo ring. And if you talk about the carbutamide is the first generation and it has amino group on the benzene ring. And if you talk about the tolbutamide is also a first generation. It has simple a butyl group as a sulfoside chain. Okay, simple. And if you talk about all these, this gluburide, that is option number B, that is your correct. Gluburide is the most potent, and but it also has the highest risk of hypoglycemia. It is the most potent, but it also has the highest risk of your hypoglycemia. So the correct answer is your option number B, that is the glyburide is the right answer. Okay, simple. Next question. Question number 70. What the question number 70 is saying? Anti-lipidemic agent which act by inhibiting the HMG-CoA reductase inhibitor. So we have to find the HMG-CoA reductase inhibitor. But what is this HMG-CoA reductase? HMG-CoA reductase is the rate limiting enzyme. HMG-CoA reductase is your rate limiting enzyme in cholesterol biosynthesis. And they convert your HMG-CoA into mevalonate. They convert HMG-CoA coenzyme A into what? Into a mevalonate. Okay, so which of the following acts by inhibiting these enzymes? The first option is your simvastatin, the second option is your probucol, the third option is your cholesterol, the fourth option is your beta sterosterol. So which of the following is the right answer? A, B, C or D? So statins are the HMG-CoA reductase inhibitor. Just remember, if you have to identify the HMG-CoA reductase inhibitor, just go with the statin. So the correct answer for this question is your option number A, simvastatin. And remember that simvastatin is also a pro-drug, and it contains what? It gets activated into the liver, and that active hydroxy acids is formed. Okay, simple. And next, your probusol is what? Probusol is an antioxidant and it lowers the LDL level. And if you talk about the cholesterol is a bile acid sequestrant. It is not a what? It is a not your HMG-CoA reductase inhibitor. It is a bile acid sequestrant, and this is your beta cholesterol. It is your plant sterol, and it competes with the cholesterol absorption in the guts. Okay, so the correct answer for this question is your option number A, that is simvastatin is the right answer. Okay guys, next question. Choose the correct statement. We have to identify the correct statement. Procaine is more rapidly metabolized than the chlorprocaine. The second option is a chlorprocaine has longer duration of action of procaine. Chlorprocaine is more susceptible to ester hydrolysis than procaine. Procaine is used as a topical local anesthetic. Simple. Now we have to compare between the procaine and chlorprocaine. And if you talk about procaine is and chlorprocaine, the major difference is that chlorprocaine is a 4-chloro substituent on the benzene ring. 4-chloro substituent on the benzene ring. And when we get attached, the chloro substituent gets attached on the benzene ring, it increases the electron withdrawal. It increases the because the chlorine has the electronegativity. So it increases the electron withdrawal. That makes the ester bond, that particular ester bond, more electrophilic, and that's why it will result in faster hydrolysis. So it is more susceptible for the faster hydrolysis than procaine. Why? Because the in chlorprocaine there is a chlorine group substituted on the benzene ring and 4-chloro substitution, and due to that substitution it increases the electron withdrawal process, and when the electron withdrawing capacity increases, that ester bonds become more electrophilic, and that will result in the faster hydrolysis by the plasma. Okay, so that's why it is also, you can say that chlorprocaine has a shorter duration of action than the procaine. So it is not a longer. So option number B is your wrong. Okay, so the correct answer. And procaine is also, it is not used, if you talk about the procaine is not generally used as a topical anesthetic. It is poorly absorbed through the mucous membrane. So it is also wrong. So the correct answer for this question will be your option number C, that is chlorprocaine is more susceptible to ester hydrolysis than your procaine. Okay. Next question. Question number 72. What is the question number 72 is saying? Which of the following is not a prodrug? Which of the following is not a product? So we have discussed a simple trick. What are the simple tricks are? We have discussed that enalapril, benzopril, captopril, ramipril. So we have discussed that except Captain Lucy, we have discussed what? we have discussed the Captain Lucy. There was a Captain Lucy, except Captain Lucy, all ACE inhibitors are prodrug. So Captain means your captopril, Lucy means is your lisinopril. So all are prodrug. For example, if you talk about the enalapril, it is an what? It is a enalaprilate active form. Benzapril, the benzaprilate. Ramipril is the active form is ramiprilate. So simple. So except Captain Lucy, that is your captopril and lisinopril, all ACE inhibitors are your prodrug. Simple. And also remember that the side effect of ACE inhibitors are dry cough. So the correct answer for this question is your option number C, that is your captopril is the right answer. Okay, next question. Nifedipine. Nifedipine is what? Nifedipine is a calcium channel blocker, belongs to following which of the following class. Okay, so we have to find it the classification. So that's why I'm saying that if you guys remember the basic classification, you are guys are going to solve about 50% questions. Arylalkylamine, benzothiazepine, dihydropyridine, or diaminopropanol ether. So simple. Nifedipine comes under which class? If you talk about this arylamine, benzothiazepine, dihydropyridine. Nifedipine comes under the dihydropyridine. It comes under the nifedipine, amlodipine, felodipine. And if you talk about your phenylalkylamine, there is a verapamil. And next one was benzothiazepine. And in benzothiazepine, there was a diltiazem. Simple. There was what? There were three classes of the calcium channel blocker. First was the phenylalkylamine, in which or we can say that the arylalkylamine, in which there was a drug verapamil. Next was benzothiazepine, in which there was a drug diltiazem, and last was the dihydropyridine, in which there was the nifedipine, felodipine, and amlodipine was there. So the correct answer is your option number C is the right answer. Simple. Next question. Choose the correct statement. Again, we have to identify the correct statement. Dextro and levo isomers are amphetamine are equipotent. Next is your D-amphetamine is 10 times more potent than L-amphetamine. Next one is your 1-amphetamine is 10 times more potent than, L-amphetamine is 10 times more potent than your D-amphetamine. L-amphetamine has less cardiovascular side effect than D-amphetamine. So we have to find the amphetamine potency on the basis of their isomer, whether the dextro form is more potent or levo form is more potent. So if we talk about your D-amphetamine, that is dextroamphetamine, is 10 times more potent than your levoamphetamine because it has a central effect. If you talk about what the central effect, it has a dextroamphetamine as a 10 times more central effect. Okay, and if you talk about the cardiovascular effect, then L-amphetamine has more cardiovascular effect. So for this question, what will be the right answer? D-amphetamine is your 10 times more potent than your L-amphetamine. So the correct answer for this question is your option number B is the. And what is the mechanism of action of this drug amphetamine? What is the mechanism of action? It releases the dopamine and norepinephrine from the presynaptic terminals, and it also inhibits the reuptake. Okay, so the correct answer for this question will be your option number B is the right answer. Okay. Next question, question number 75. Haloperidol belongs to which of the following class? Again, simple classification, nothing much. Simple classification. Haloperidol belongs to which of the following class? The first option is your phenothiazine. The second option is your beta-aerophenones. The third option is your benzapins, and the fourth option is your what? Fourth option is your thiopixane. So what? Haloperidol simply belongs to which class? They belongs to butyrophenones. Butyrophenones include your haloperidol, droperidol, and benperidol. Okay, and if you talk about what? Phenothiazine includes your chlorpromazine, thioridazine, and fluphenazine. And if you talk about the thioxanthins include what? Thioxanthins include flupentixol, zuclopentixol. These are the. And if you talk about the benzapins is not a major antipsychotic class. Okay, so the correct answer for this question will be your option number B. That is what? That is your butyrophenones. And all these are what? All these are atypical. Sorry, all these are typical antipsychotics. Okay, these are the which category? These comes under the typical antipsychotics. Okay, simple. So the correct answer. But remember, there is a one side effect of haloperidol also. What? It generates EPS, that is extrapyramidal symptoms. Okay, so the correct answer for this question is option number B. Haloperidol belongs to which class? It belongs to butyrophenones. Okay. Simple. Next question. The sedative activity in barbiturates is retained only when the sedative activity of the barbiturates is retained. The first option is your position 5 is monosubstituted. The second option is position 5 is unsubstituted. The third option is your one of the hydrogen atom as position 5 is replaced with alkyl group, or the both hydrogen atoms and position 5s are replaced with alkyl or aryl group. Okay. So now what are their points? So simple. There, if at the position 5 there is a substitution for the barbiturates in order to their sedative activity to get reduced, but both the hydrogen, what happens if this position is what, if this position is unsubstituted, then there will be no sedative activity, and if that position is monosubstituted, then there is a sedative activity but weak sedative activity. But in order to get the higher sedative activity, there should be the di substitution, that is the both hydrogen at position 5 are replaced with the alkyl or aryl group, and it increase what, increase the optimal lipophilicity, and also increase the what, also increase the receptor bindings. Okay, so the correct answer for this question will be your option number D will be the right answer, guys. Okay, next question. In case of a benzodiazepine class, of sedative hypnotics, the presence of phenyl ring at fifth position, benzodiazepine class, the presence of phenyl ring at fifth position, the first option your results in decrease in the potency, the second option is your will not alter the activity, the third option is your result in increase in the activity, and the fourth option is your result in the total loss of activity. Simple. Benzodiazepine fifth and phenyl ring at the position fifth. So when there is a substitution of phenyl ring at the fifth position of benzodiazepine, that will result in what? That will result in increase in the potency of the benzodiazepine. Why? Because it will enhance its activity to bind with the GABA A receptor, and the phenyl ring at C5 position fits into its hydrophobic pocket on the GABA A receptor, and that will increases what? That will increases your affinity, and when your affinity will increases, its activity will also increases. So the correct answer for this question will be your option number C will be the right answer, guys. Okay, next question, question number 78. The separation in the SDS space is based on SDS, that is your sodium dodecyl sulfate. The separation is based on, the first option is your shape, charge, molecular weight, and pH. It is what? SDS is what? SDS is your anionic detergent. Simple. It, what happens, it denatures your proteins, and it also coats the protein uniformly with negative charges. So here, but it also makes all protein have same charge to mass ratio. It makes what, it first things, it denatures the protein, that it breaks its their 3D structure, and it also coats the protein uniformly with the negative charge, and that also results in making all proteins have same charge to mass ratio, and that will result in separation of what? That will result in separation of your molecular weight. So the separation in SDS space is based on what? Is based on your molecular weight. So the correct answer is your option number C. And if we talk about in the Western blotting technique, we use the SDS space separation plus antibody detection. So the correct answer for this question will be your option number C is the right answer. Okay, next question. Which of the following is not a component of Karl-Fischer reagent? Which of the following is not a component of Karl-Fischer reagent? The first option is your hydrochloric acid, the second option is your pyridine, the third option is your sulfur dioxide, and the fourth option is your methanol. We have discussed this earlier also. So which of the following is not a component of Karl-Fischer reagent? A, B, C, or D? Simple. What are the components of the Karl-Fischer reagent? There are four main components. The first is your iodine is there, then your SO2, that is sulfur dioxide, is there, then what, then your pyridine is there, and at the end we also uses the methanol. Okay, so these are the main constituents, but we don't use it hydrochloric acid here. So which of the following is not a component of Karl-Fischer reagent? Your hydrochloric acid is not a component of Karl-Fischer reagent. So the correct answer for this question will be your option number A. And what is the use of this Karl-Fischer titration? It is used in the moisture determination in your hygroscopic drugs. Okay, so the correct answer for your option number A is the right answer. That is hydrochloric acid will be the right answer. Okay, guys. Next question, question number 18. In gas chromatography, a suitable gas carrier for electron capture detector, that is your ECD, which of the following will be the suitable for your ECD? In electron capture detector, it uses what? It uses your beta radiation to ionize the carrier gas, and then after that, that will become the sensitive to electronegative species like halogen and nitrogen groups. So what will be the right answer? The right answer for this question will be your argon gas. We use why? Because it is a chemically inert, it is efficiently ionized by the beta radiation, and it does not interfere with the electron capture processes. What other gases can also be used in your ECD, sorry, in your gas chromatography, not in ECD, in gas chromatography is your hydrogen and helium can also be used. Sorry, helium and nitrogen, not hydrogen. Helium and nitrogen can be used, but hydrogen can also be used, but it has the fastest carrier gas, but it has the it's a negative point also. It is a flammable in nature. Okay, so the correct answer is your option number D, and we use the hydrogen in flame ionization detector. Okay, so the correct answer is your option number D. So not helium, we use it in D, that is argon is the right answer. Okay, next question. A hydrophobic stationary phase is combined with a polar mobile phase in. Okay, so hydrophobic stationary phase plus polar mobile phase. Okay, simple. Polar mobile phase, A is normal phase, B reverse phase, C size exclusion, D. Okay, simple. In reverse phase, what? In reverse phase, simple, just remember these points. In reverse phase what happens? Your stationary phase is your non-polar and your mobile phase is polar, just remember, simple. And in normal phase what happens? Your stationary phase is polar and your mobile phase is non-polar, just remember this. Reverse phase stationary phase non-polar, mobile phase polar. In normal phase stationary phase polar, mobile phase non-polar. And here what happens? Polar mobile phase, they have says that mobile phase is polar, and mobile phase is polar in which? In your reverse phase HPLC. The correct answer for this question will be your option number B, will be the right answer. Simple, very simple question. Next question. Which of the following is known as the fingerprint region in IR spectrum? Fingerprint region in IR spectrum. Simple. A 1300 to 400 minus, no, the correct answer is your option number A, that is 1300 to 400 centimeter inverse comes under your fingerprint region. And if we talk about what? If we talk about the this is your 4000 to 1300, not this. If 4000 to 1300, this is what? This is your functional group region. This is your functional group region. The fingerprint region comes under your 1300 to 400. So option number A will be the right answer. Okay, next question. On the basis of Woodward-Fisher rule, parent value of alpha beta unsaturated aldehyde, the parent value of your alpha beta unsaturated aldehyde is your option number A 215 nanometer, option number B 253, 202 and 210 nanometer. So what will be the right answer? So the parent value of alpha beta unsaturated aldehyde will be your option number D, that is 210 nanometer will be the right answer. In some books you can also find the 208 nanometer is also. So both the values are correct. Okay, either 210 or 208 nanometer will be the right answer. Okay, next question. In potentiometry, electrodes of the first kind of potentiometry. So first kind potentiometry, the electrodes are considered as A reference electrode, B metallic indicator electrode, C glass membrane electrode, or D ion selective electrode. So electrodes of the first kind are considered as A, B, C or D. So electrodes of the first kind, that is what? That is a metal in contact with its own cation solution. Electrodes of first kind is what? Metal in contact with its own cation solution, and that in that potential will be directly dependent upon the ion concentration. For example, copper electrode in what? Copper electrode in Cu2 plus solution, or Ag electrode in Ag plus solution. So these electrodes are known as what? These electrodes are known as your metallic indicator electrode. So correct answer for this question will be your option number B, metallic indicator electrode. Simple. And if we talk about the reference electrodes are what? Reference electrodes are your maintain the constant potential. They are not the indicator, they maintain the constant potential. And glass membrane electrodes are the pH electrode, and they are ion selective for the H plus ions. Okay, so the correct answer for this question will be your option number B. Next question, question number 85. What the question number 85 is saying? Which of the following is not a component of filter fluorometer? Which of the following is not a component of filter fluorometer? A monochromator, B excitation filter, C secondary filter, or D photomultiplier tube. Okay, so what happened in filter fluorometer? If we look into the filter component, the first one is your light source. The first one will be your light source. After light source there is what? After light source there is the excitation filter. After light source there is a excitation filter, and after that we add the sample, and at sample, after sample there will be what? There will be the emission filter, or we can say it a emission or secondary filter. We can say it the emission filter or a secondary filter. And after that there is what? After that is your photo multiplier tube, then we get the reading. After that your photo multiplier tube, then we get the reading. But we are not using the monochromator. We are using the filters here. We are not using the monochromator. Okay, so the correct answer for this question will be monochromator, because they have asked which of the following is not a component. So the correct answer is your option number A is the right answer. Okay. Next question, question number 86. What is the question number 86 saying? Which one of the following element is not detectable by the flame fluorometry? Which we cannot detect the flame fluorometry. So flame photometry detects the element. Which type of elements can be detected? The elements that emit a characteristic visible light when excited in a flame. Means that the elements that when excited in a flame, they emit a characteristic visible lights, that elements can be detected. Okay. Now the options are your sodium, the second is your lithium, the third one is your chlorine, and the fourth one is your barium. So except chlorine, all are a metal. All are what? All are a metal, and they can emit a specific visible light, a specific flame. But chlorine is a non-metal, and it requires very high excitation energy to emit what? UV or visible light. That why it is not detectable in flame photometry. So the correct answer for this question will be your option number C, that is the chlorine. Next question, question number 87. What the question number 87 is saying? In a polarography, the relation between diffusion current and the concentration of a depolarizer is explained by. Okay, so which is used to explain that what? Diffusion, relation between the diffusion current and concentration of the depolarizer. Option A is your Nernst equation, option B 𝘿𝙄𝙎𝑃 equation, C Ohm's law, or D Stokes shift. Okay, so if we talk about the Nernst equation, Nernst equation relates electrode potential with to ion concentration, and it is used in thermodynamics. Ohm's law is what? V is equal to IR. It is a basic electricity law. Polarography or Stokes shift. We use the Stokes shift and polarography. In Stokes shift is used what? Stokes shift is difference between the excitation and emission wavelength in fluorescence. Stokes shift gives what? Stokes shift gives the difference between excitation and emission wavelength in fluorescence. But 𝘿𝙂𝙎 equation gives us the difference between the diffusion current and concentration of the depolarizer. So the correct answer for this question will be your option number B, that is the 𝘿𝙂 equation is the right answer. Simple. The next question. One of the following is used as an indicator in oxidation reduction titration. One of the following can be used as an indicator in redox titration. A is thymol blue, B methyl orange, C neochrome black tea, or D is methylene blue. So which one of the following can be used as an indicator in your redox titration? Is your methylene blue can be used. So the correct answer will be your option number D is the right answer. Okay. Next question. Question number 89. Which one of the following approaches utilizes the thermal decomposition to monitor the sample's mass? In order to monitor the sample mass, which can be used to utilize the thermal decomposition. The first is your volatilization gravimetry. The second one is your precipitation gravimetry. The third one is your electrogravimetry. The last one is your particulate gravimetry, which is used. So in order to approach or utilize the thermal decomposition to monitor the sample mass, which gravimetric technique is used is your volatilization gravimetry. What happens in this technique? Sample is heated, then your volatile component is driven off. After that, your mass, the mass loss that happens is measured, or the volatile component that is driven off can collect it and its weight. Okay, so it can use to calculate the loss of drying also. If you talk about your remaining thermogravimetric analysis and all, there is no utilization of this thermal decomposition monitor. So the correct answer for this question is your option number A, that is the volatilization gravimetry. Okay. Next question, question number 90. Precision of an measurement is affected by. Okay, so precision of an measurement can be affected by your systemic error, random error, determinate error, or personal error. Okay, what is this precision? Precision is your reproducibility of results, and it can be affected by your indeterminate error, that is also known as your random errors. Okay, so random errors are what? They are unpredictable and it is cannot be corrected. Okay, if you talk about your systemic error, these are consistent and directional and can be identified and we can correct. Determinate error, that is the already known, their cause is known. Personal error is depending upon the person. So the correct answer for this question will be your option number B will be the right answer. Okay, so the correct answer is your option number B. Next question, question number 91. Which one of the following is an example of secondary standard? Which one of the following is a secondary standard? Sodium chloride, sodium oxalate, sodium hydroxide, or sodium carbonate. Secondary standard A, B, C, or D. Sodium chloride, sodium oxalate, sodium hydroxide, or sodium carbonate. We have already discussed in the previous question paper also, that the secondary standard, the example of secondary standard is your sodium hydroxide. Remaining all comes under what? Remaining all comes under your primary standard. So the correct answer for this question is your option number C, that is the sodium hydroxide is the right answer. It is a secondary standard. Secondary standard, why? Because it is in hygroscopic nature and it can absorb the CO2 from the air. Okay guys, so with this we have finished our pharmaceutical chemistry portion. Now you guys will solve the question from the pharmacognosy. If you have any doubt, any question in this particular section, feel free to mention that in the comment section. I will respond that questions. Okay guys, and not only focus on the questions and answers, just focus on the explanations and also, because these are going to make you guys answer more questions in the exam. Okay, so with this I'm ending this portion. Thank you everyone, thank you for joining.
So hello guys, let's start with the pharmacognosy section. Okay, so yes, this is going to be the first question. This is on your screen, the kidney test. They are asking about the kidney test, specifically, or will give a specific color reaction for the detection of either saponins, either flavonoids, either the cardenolite or cardinolites, either the flavonoids. Yes, the kidney test is mainly given by what? The kidney test is mainly given by the cardenolites, that are also known as the cardiac glycosides. Okay, the what color they cardiac glycoside will give? They are mainly give the blue or violet color. Blue or violet color. Okay, and what is the kidney reagent is? The kidney reagent is nothing but it is a mixture of what? The 2% solution of, the 2% solution of 3,5-dinitrobenzoic acid. Dinitrobenzoic acid. Okay, with how much percentage of? 7.5 percentage of 7.5% aqueous solution of sodium hydroxide, KOH. That will mainly give a color that is blue or violet in nature with that of the cardiac glycoside and the cardinolites. Okay, yes. So C is going to be the correct option of it. Moving towards our next question, which of the following is a kind of bicyclomonoterpenes? Okay, it will mainly contain how many units? 2 isoprene units in it. Isoprene units in it. And peroxide. So they are asking about peroxide. So that kind of peroxide linkage should be present in that particular compound. And the formula of that particular compound having the 2 isoprene unit can be written as follows: C10H. C10H 16, and the 2 units of forming the peroxide bond O2. Okay, the example of it is camphor, bornol, centanol, and ascaridol. Yes, which is going to be the example of it. Which is going to be the example of it. Yes, the ascaridol, which is obtained from the ascaris plant, that is also known as American worm seed oil. American worm seed oil. Okay, American worm seed oil. And as the name indicates, ascaridol is mainly used for the treatment of, that is, roundworm treatment. Name of that particular roundworm is going to be what? Ascaris itself. Okay, so these are the some important properties that are related to that bicyclomonoterpene peroxide class of that compound, that is going to be the ascaridol. Okay, coming towards our next question. Yes, which of the following is one of the active ingredient used in a typical preparation of the treatment for muscular and joint pains? The 𝘂𝙬 oil, the lemongrass oil, the jatamansi oil, and the avena oil. The 𝘂𝙬 oil is going to be the answer. The 𝘂𝙬 oil is the kind of only oil that is mainly isolated or will having a content in it which is mainly the methyl salicylate. Methyl salicylate is a kind of compound that is mainly responsible for its rubefacient action. Rubefacient action, or its anti-inflammatory property, or its analgesic property. Okay, yes, and the 𝘂𝙬 oil is also known as what? Oil of wintergreen. Oil of wintergreen. The family to which it belongs to is mainly the Ariaceae family. Okay, the family to which that particular thing will belong, or the particular 𝘂𝙬 oil is belong, is mainly the Ariaceae family. So option A is going to be the correct answer. Coming towards our next question, the ferric chloride, that is FeCl3. Solution produce a pale yellow green color in the presence of cassia oil, clove oil, okay, the cinnamon oil or the tulsi oil. Yes, the particular cinnamon oil will mainly give a pale yellow color in presence of that particular ferric chloride. Okay, so we have to discuss something about more about the cinnamon oil. It will mainly belong to the family Lauriaceae. Okay, and will having its two component. Firstly is isolated from its bark, and one can be isolated from its leaf. Okay, so the component that is isolated from the bark is mainly the cinnamaldehyde, but the component that is isolated from its leaf is the eugenol. Okay, and for the eugenol or the presence of the alcoholic compound is mainly detected by that FeCl3, that will mainly give what color? The pale yellow color of it. Okay, and what are the properties? All know the cinnamon will having the anti-carbonic properties, means it will mainly reduces the gas, as well as the another property of the cinnamon is antimicrobial property. So these are the other important information. So C is going to be the correct option. Which of the following is a chromoalkaloids? Chromoalkaloids means that gives color. So most of the alkaloids are colorless in nature, but some of the alkaloids are colored in nature. So that's why they are also known by the name of chromoalkaloid, because they are chromogenic in nature. So they can be of different color, like yellow color, like we can know copper red color. Okay, copper red color and red color. So as the red color indicate, betadine is a medicine that is of red color. So betadine is of red color. Okay, copper red color, sanguinine is of copper red color. And for the particular yellow color, the three alkaloids that having a particular yellow color. The first one is the palmitine. The second one is the barbaloin or barbaline. And third one will be the tylophorine. Are the kind of chromoalkaloids that will mainly gives the color A, B, and C. So they are mainly asking about the chromoalkaloid, the caffeine, the conine, or what? The betaine and the nicotine. Yes, betaine is going to be the answer. So C is going to be the correct answer. Moving towards our next question, that is what going to be the binary alkaloids. So we have to correct this question, particular question. They are not asking about the binary alkaloid. They are mainly asking about the tertiary alkaloid or ternary alkaloid. Okay, tertiary alkaloids are present in option A is the Vasaka, option B is the Catharanthus roseans. We can also say it the Vinca rosea. Option C is the opium, and option D is the colchicum. Okay, so which option is going to be the correct? So tertiary alkaloid or ternary alkaloid can be the considered as that of the indole alkaloid. Why the indole alkaloids are also known as the tertiary alkaloid? Because they will have a 3-degree nitrogen in them or a tertiary nitrogen in them. Okay, the tertiary nitrogen is somewhat this kind of nitrogen. Okay, and the plant that belong to that particular indole category can be written as ENRCP. So E is mainly an indicative of ergot plant, that is very important plant. N is an indicative of Nux vomica. R is a mainly indicative of Rauwolfia, that is isolated from the plant Rauwolfia serpentina. C is mainly the Catharanthus roseus or Vinca rosea. And P is mainly indicated of physostigma, that having the biological source of it is Physostigma venerosum. So mainly the answer for that is going to be the B. Okay, coming towards our next question, the stone cells, the scalarides or the sclerenchyma is absent in, we can also say it the sclerenchyma. And sclerenchyma is a kind of dead tissue. So whenever anyone is talking about the dead tissue, the main function of that particular dead tissue or the sclerenchyma is to support the given structure, the given plant structure, to produce the support. So, okay, option A is Rauwolfia, option B is the Kurchi, option C is Cascara, and option D is going to be what? Option D is going to be the aconite. So yes, the 𝙤𝙂𝙎 is a kind of plant that will not have the stone cell, the scalarides or the �々𝘾𝙬𝙗 in it. The 𝙤𝙂𝙎 is also known by the common name of Chota Chand, and also by the name of Sarpagandha. Okay, and will mainly belongs to the family Apocynaceae, and having two important constituent isolated from it, 𝘎𝐺𝑚𝐴𝑙𝑒ne, and another one is 𝘎𝐺𝑚𝐴𝑙𝑖cine. So as the C indicates here, it will mainly having its effect over the C and S, but the 𝘎𝐺𝑚𝐴𝑙𝑒ne having its anti-arrhythmic property. So these are other important points that are related with that of the 𝙤𝙂𝙎 plant. So is going to be the answer. Moving towards our next question, which of the following is used in a combination with 𝘎𝐵𝑡 tartrate in order to treat the migraine? Okay, so option A is quinine, option B is caffeine, option C is dobuline, and option D is going to be what? Imetine. So for that particular question, we have to think that yes, the caffeine is going to be the answer, because the caffeine will mainly increase the absorption, okay, of that particular 𝘎𝐵𝑡 tartrate. And the second thing that the given caffeine is producing is mainly the contraction of brain ventricles, that in turn will mainly related to the reduction of migraine itself. So both of these, firstly the 𝘎𝐵𝑡 tartrate and second one is the caffeine, are in a combined way will mainly producing the contraction of the brain ventricles, or will mainly decrease or helpful in the decrease of that particular migraine. So they are given in a combination. Okay, so B is going to be the answer. Option and question 100th question is, okay, which of the following is an example of anthraquinone C type of glycoside they are asking about? Option A is sinusoid A, option B is sinusoid D, option C is the carbonic acid, and option D is the hyprosides. Okay, so whenever we remember the C type of glycoside, we remember it with a trick. A is mainly stand for alloy, C is mainly stand for cascara, and C cochineal is also a marketive of cochineal. The cochineal is a kind of insect that will mainly produce what? Carbonic acid. So yes, there is an option C, that is the carbonic acid is an example of what kind of glycoside? C glycosides that will having a C linkage in between their glycon part and their A glycon part. Okay, so C is going to be the answer. Moving towards our next question, the botanical name of the Chinese gentian is. So gentian is mainly indicated by the Panax. Okay, Panax. If it is the Panax noto, so noto is mainly indicated of height. So it's mainly related to what? Chinese gentian. If it is mainly related to quinquillozoline. Okay, quinquillozoline. So queen is from where? Queen is from America. So American gentian is what is there. Okay, if it is the Japonica variety, so it is mainly from Japan. Okay, and if it is the gentian variety itself, so it is mainly from Korea. So they are mainly asking about the Chinese gentian. Chinese gentian is Panax noto gentian. That is the Chinese gentian. So Panax noto gentian. Option B is going to be the correct answer. Okay, which of the following is an example of the chemical classification of the crude drug? Option A is the 𝘎𝐿𝐴 cola. Option B is cascara and ashoka. Option C is the gelatin and jalap. And option D is the eucalyptus and senna. So, in the case of 𝘎𝐿𝐴, that the I indicate is a kind of what? Is a kind of imidazole, or having the imidazole ring in it. Okay, and but the cola or the coca, like tea, coffee, are mainly related to purine alkaloids class. The component that is isolated from the cola can be the theobromine, and the another compound can be the caffeine, but the compound that is isolated from the imidazole alkaloids, that is the pilocarpine, is what? Is what? The pilocarpine. The biological source from which the pilocarpine is isolated is the Pilocarpus zaborindi. So they are asking about the chemical classifications. Yes, the Pilocarpus and cola will belong to the same chemical classification. So A is going to be the correct option. Okay, so moving toward our next question, which of the following is a kind of an example of unorganized drug? Option A is nutmeg, option B is musk, option C is asman, and option D is podophyllum. So the musk is a kind of unorganized drug. So the drug that have not defined structure and not isolated from a particular plant part is known as musk and is known as unorganized drug. Musk is going to be the one of the example of it, and it is mainly isolated from the perpetual gland of musk deer. And this musk deer should be male. Okay, and the component that is responsible for its aromatic order is mainly the mescon, isolated from it aromatic principle, responsible for the aromatic principle. The other example of the unorganized drug or unorganized drug are going to be the aloe vera juice, okay, the opium, okay, the gums, that can be the gum acacia, and the latex from that of the plant are going to be the example of some other unorganized drug. So B is going to be the correct option. Moving towards our next question, that is, which of the following is an example of biofertilizer? Option A is the biogas slurry, option B is the press mud, option C is the fish meal, and option D is going to be the rhizobium. Yes, whenever they are the thing that is mainly related to the fixation of nitrogen to that of the soil are mainly act as a biofertilizer. So rhizobium is going to be one of them. So first example we can consider rhizobium. The other example that are related or can be asked in your exam are the biofertilizers, that can be the azobacter. Azospirillum can also be a biofertilizer. Okay, then we come to the cyanobacteria. The symbiotic nature that is shown by the algae and fungi, that is the mycorrhiza. Okay, are the example or the some other example other than that of the rhizobium that are act as an biofertilizer by nitrogen fixation. Okay, so D is going to be the correct option. We are moving towards our next question. Which of the following are artificially prepared by? Which of the following is mainly artificial or prepared by the substance? Artificial, substituted by the substance. So which is it? So option A is going to be what? Option A is going to be the beeswax. Option B is mainly the clove. Option C is going to be the cinchona, and option D is going to be the ginger. The substitution with the artificially prepared substance. Yes, the beeswax is most commonly being replaced by with that of the with that of what? With that of paraffin wax. Most commonly it is being substituted by the paraffin wax, but it can also be substituted by the carnauba wax or by the stearic acid. Okay, so beeswax is mainly substituted by the paraffin wax, most commonly substituted. So A is going to be the answer of it. Okay, then we comes to another question. The volatile oil content that is not less than 15% weight by volume is present in cardamom, cassia, lemongrass, and the clove. Yes, the particular plant clove will having a total of 15 to 20%, okay, of volatile oil content. And out of this 15 to 20%, about 70 to 90% is eugenol itself. And the family to which the given clove is belong to is Myrtaceae family. Myrtaceae family. So these are other important points that are related to the plant clove, that having a total content of around 15 to 20% of volatile oil, and eugenol concentration from all this volatile oil of about 70 to 90%. So D is going to be the correct option of it. Okay. Yes. So this is all about from our pharmacognosy section related to the explanation of that particular paper. I think you guys have enjoyed that particular section. Thank you for giving your precious time. Thank you so much.
Hello, dear students. Welcome back to GDC Classes English. So, in this video, we are going to talk about the other part of this 2028 TG PGECET exam. Let's start. So, the first question is anaerobic glycolysis of one molecule of glucose produced. So, let's talk about this. So, if we'll talk about your glycolysis, so you get two end product. Okay, one is pyruvate, another one is your lactate. Okay, so pyruvate is generated during your aerobic glycolysis. Okay, during aerobic glycolysis. Lactate generated during anaerobic glycolysis. Okay, now, so aerobic glycolysis, you total ATP produces 8. In anaerobic glycolysis, total ATP produces 2. Okay, so here the option will be option A, that is 280. Okay, chalo, next question. Carnitine acetyl transferase is inhibited by. Okay, so let's understand this by its mechanism. So carnitine acetyl transferase, also known as carnitine palmitoyl transferase, also known as carnitine palmitoyl transferase. So this basically inhibited by your malonyl coenzyme. Why? Let's discuss. So this malonyl coenzyme question will be when this will be produced. It is produced during lipogenesis. That means synthesis of fat. So let's assume two scenario. In one cases, you are doing exercise, or one cases you are feed state. You taken your meal. So now how this malonyl coenzyme will act and how it will be get inhibited, let me explain. When you are in feeding state, you have a high insulin level, yes or no? High insulin level. When insulin level is high, so what it causes? It inhibit your fatty acid synthesis. Okay, because sorry, it will activate your fatty acid synthesis. Because when you are having full meal, so when insulin is there, your fatty acid synthesis will be occur. But let me say your fat synthesis will be occur. So fat synthesis occur means your malonyl coenzyme level will be high. Yes or no? When malonyl coenzyme level is high, it will inhibit your carnitine palmitoyl transferase, we shortly known as CPT1. Okay, CPT1 is inhibited. Then when it get activated, so when you are doing exercise means you need energy. That means in case glucagon or your epinephrine, this will be high. This will be high in your body. When this will be high, your fat breakdown will be start. When fat will break down, your malonyl coenzyme level will be low. That means in that cases, your CPT will not inhibited, your CPT will be activated. I hope you got your answer. The correct answer is option B, or malonyl coenzyme, and I gave you the complete explanation. Next question. One of the following intermediate that is produced in the urea cycle is formed inside the mitochondria or liver. Okay, let's talk about this. So your urea cycle it takes in your liver. In liver it will type part, some part will be carried out in cytoplasm. Okay, and some part will be carried out in mitochondria. So now your question is, in which part is produced inside the mitochondria? So let's talk about this. So what is the starting material? The starting material is when ammonia react with carbon dioxide. Okay, it will form carbamoyl transferase 1, carbamoyl carbamoyl phosphate. Okay, it will form carbamyl phosphate. So enzyme that works here name is carbamyl phosphatase synthetase. Okay, carbamyl phosphatase synthetase 1, and it also require N-acetyl glutamate for the activation. So now this carbamyl phosphatase 1 again converted to citrulline to ornithine like that. So this part is carried out in your mitochondria. That's why I was talking. So carbamyl phosphate is basically synthesized in your mitochondria. Okay, so option C is correct answer. Next question. Which of the following type of disease is a cause due to defect in the purine metabolism? Okay, which is of course due to defect in purine metabolism. Let's start. So what is type 2 diabetes? So type 2 diabetes is basically your insulin resistance, your metabolic disorder due to causes hyperglycemia. Orotic aciduria, this is occurs due to high orotic acid production, is orotic acid products produced and excreted in urine. Atherosclerosis, deposition of the plaque, deposition of your fat, and gout is your basically associated with metabolism of urine. Okay, gout is associated with metabolism of urine. So here option D is correct answer. Okay, chalo, next question. In a bioequivalent study, statistical evaluation is not required. So first is, let's talk about in this in detail explanation. For calculating, please understand. For calculating 90% confidential interval of bioequivalent study, you need three things. What is it? One is your area under curve, one AUC, second one is your Cmax, and your plasma concentration. But you do not no need of your Tmax. Why? Because what is Tmax? Tmax is the maximum plasma concentration at this point of time. Okay. So according to this, Tmax is basically depends upon your blood sampling. Okay, blood sampling frequency. When you are taking the blood at after how much time interval? For suppose I am taking the drug right now. You are taking the blood plasma in 2 hour, 4 hour, 6 hour. So it depend upon the blood collection frequency. Another what is the, it is not required to calculate the 90% confidential interval. So this Tmax has high importance. So Tmax is basically calculated basically uh, uh, com taken into consideration by different regulatory agency like your FDA, like your European Medical Agency, like your CDSCO. So they basically check this Tmax level for a particular. Okay, so your Tmax is not required for the statistical evaluation. Next question. Oral polio vaccine is a, now question is about oral polio vaccine. Chalo. So let's talk about this. So types of polio vaccine. If you will see your polio vaccine, there are two type of polio vaccine. One is your Sabine, another one is your Salk. Okay. The Salk is basically developed by Jones Jones Slock. Jones Salk developed it. So it basically is a Salk vaccine is a killed polio vaccine. Okay, and it given through IM route. If we talk about Sabine, Sabine is a live attenuated, and live attenuated. And second point is what? It is given through oral. So question is about oral polio vaccine, that is Sabine. Sabine is a live attenuated. That means option C is correct answer. Okay, chalo. Next question. Next question is intravenous administration of immunoglobulins. Chalo, let's talk about this. So intravenous administration. So you are adding intravenous immunoglobulin. So these all are comes under your acquired immunity. So acquired immunity are two type. Either this is natural or it is sorry, it is either it is active or it is passive. Again, active comes under natural. Mhm. Just do some changes. It is natural or artificial. Again, natural is two type, artificial is also two type. Either it is active or it is passive. Similarly, either it is active or it is passive. So acquired natural active immunity is basically developed when you expose to a certain pathogen. If your body develop immunity, that is comes under your natural acquired active immunity. What is passive immunity? The transfer of immunoglobulin from mother to fetus, that is immunoglobulin G, that will provide a protection in your in a newborn in case of fetus. That is comes under acquired natural passive immunity. Your question is about intravenous immunoglobulin, IV immunoglobulin. So IV immunoglobulins are preformed antibody. So when it is preformed antibody and it is artificial, so it is comes under your artificial acquired passive immunity. Artificial acquired passive immunity. Option D is correct answer. Next question. As per the IP, Micrococcus luteus is used. So Micrococcus luteus is used for the bacitracin. For bacitracin, the species is Micrococcus luteus. For tetracycline, it is Bacillus subtilis. Bacillus subtilis. For nystatin, is your Saccharomyces cerevisiae. Saccharomyces cerevisiae. For gentamicin, we use Bacillus pumilus and Streptococcus epidermatitis. Streptococcus epidermidis. Okay, so here for Micrococcus luteus is used for the bacitracin. Option B is correct answer. Next question. According to IP, one of the following medium is suitable for the fungi. If we'll talk about fungi, the suitable medium is soybean casein digest. So let's talk about the other one. What these other mediums are used for, what other purposes. So first one is fluid thioglycolate medium. Fluid thioglycolate medium. It is used for the both aerobic or anaerobic bacteria. Next is your alternative fluid thioglycolate medium. So this is used for the uh, strictly anaerobics. Strictly anaerobes. Third one, soybean casein. Soybean is used for the fungi. And last one is thioglycolate. So thioglycolate is used for the anaerobes. Okay, like your Clostridium. Okay, chalo, next question. The sterilizing action of ethylene oxide. So ethylene oxide is a which type of sterilizing agent? It comes under your gaseous sterilization. Okay, it comes under your gaseous sterilization. So why it is used? It is used for the sterilizing plastic syringe, needles, okay, many other things we can sterilize by this. So what is the mechanism? It basically causes alkylation in the microbes. Okay, it causes alkylation of the microorganism. So option D is correct answer. So next question. Which of the following is not used as a biological indicator for the sterilization process? So in the sterilization process, we have discussed the biological indicator. So biological indicator, Bacillus streptothermophilus, yes, it is used. Geobacillus streptothermophilus, yes, it is used. Bacillus subtilis is also used. E. coli is not used as a indicator for uh, your sterilization process. So option A is correct answer. So you can see Moist heat, Geobacillus streptothermophilus. Dry heat, Atropius and Bacillus subtilis. Ethylene oxide, Bacillus atropius. Radiation, Bacillus pumilus. Plasma hydrogen peroxide, Geobacillus streptothermophilus. E. coli is not used. Next question. Non-compartmental pharmacokinetic analysis based upon. So non-compartmental pharmacokinetic analysis basically based upon your statistical movement theory, SMT. So statistical movement theory basically measures your two things. What it measures? One, it measures your zeroth point. One, it measures the zeroth movement. Another, it measure the first movement. In zeroth movement, what it measure? It measure area under curve. And first it movement, it measure the AUMC. AUC and AUMC can be measured by this. So option C is correct answer. Next question. Dilute nitric acid is used to limit test of chloride because why we use dilute HNO3? So the limit test of chloride reaction is Cl minus when react with Ag dilute nitric acid, AgNO3 AgNO3 in the presence of dilute HNO3, it will give AgCl will be formed plus NO3. So this AgCl is a opalescence. Okay. So why we question will be why this dilute HNO3 used? It is used to eliminate the interference by ions such as carbonate. What are other uses of this dilute nitric acid? Basically prevents false positive. It prevents false positive result false positive result due to positive result, as well as it will helps in acid solubilization. It also helps in acid solubilization. Okay. So option D is correct. Last question. Which of the following type of ELISA has a higher sensitivity? So please remember the order. So sandwich ELISA is highly sensitive. Then comes is your indirect ELISA. Then comes your direct ELISA. Please remember this hierarchy. Okay. First, the most what we can call most sensitive ELISA is your direct. Most sensitive ELISA is your sandwich ELISA. Next is your indirect ELISA. Next is your direct ELISA. And if your question will be why sandwich ELISA is more what we can call more sensitive, because if you remember in sandwich ELISA we use two type of antibody. One is your capture antibody and second one is your detection antibody. Okay, so this capture antibody is pre-coated inside the ELISA, and when we add the our sample, that the antigen present in the sample will going to bind to that capture antibody. Then you have to add this detection antibody, and this detection antibody is associated with a enzyme. When it binding with this, there will be formation of a specific product, which will ultimately give you a color which we are going to detect. Okay, that's all for today. I hope this explanation is clear to all of you. Thank you. Thank you so much.